Hello everyone, a very good afternoon. Thank you very much for joining us today. Once again, we are here on a very interesting session with Hair Channel, and I am Dr. Vaishnavi, fondly known as Dr. B, and today we have Dr. Inder, the founder of Hair Transplant Center and also Klinik Dr. Inder.
Thank you so much, Dr. V.
And first and foremost, before we go on to today's extremely interesting topic, I would like to congratulate Dr. Inder first for being awarded Anugerah Ikon Usahawan Tahunan 2020 untuk rawatan folikel rambut dan estetik, which simply means she has got the award for Entrepreneur Icon 2020 for treatment of hair follicle and aesthetics. Congratulations, Dr. Inder.
Thank you. I think it's well deserved with the years of experience.
It is, Dr. Inder. It is super well deserved, and my heartiest congratulations.
Thank you so much. It's been my passion actually to do all this for everyone.
And Dr. Inder, today, like I said, we're going to be talking on something that is very interesting and it's often missed. We are going to be talking on female pattern hair loss, and who better to discuss this particular interesting topic with than the one and only diplomate in Malaysia for American Board of Hair Restoration Surgery, ABHRS.
Thank you, Dr. B. Over the years of my hair restoration journey, the last 1 or 2 years, I've been seeing more and more female coming to see me, to actually ask me what is happening to their hair, and they're looking for treatments for female pattern hair loss. So nowadays, we are actually in a week, I'm doing at least 2 or 3 hair restoration for female pattern hair loss.
Yes, and it's very different from the counterpart, the male pattern hair loss that we often speak about in terms of the pattern, in terms of the causes, even treatment options differs very easily, like for both male and female. And Dr. Inder, just want to find out, how is female pattern hair loss different? We always say it's very different, but how is it different, doctor?
Actually, you know, when I consult, when a male walking into my clinic, I have to totally tune my mind to how exactly to talk.
And you always tell us that as well.
When a female walking, I say, oh God, you know, it's going to be very complicated now. So it's going to be a lot. First of all, it will be history taking, a very detailed history taking. So the causes can be many things. It's not just focus like male pattern baldness, because genetic plays about 80% role of male pattern hair loss, but female is totally different. So we go into a very detailed history taking in a female pattern hair loss.
When we speak of history for female pattern hair loss, doctor, we do ask them on their genetic factors as well.
Yes,
because
genetic.
it is also a component for them. And besides that, we do ask on something that's a bit more personal. We do ask them on their menstrual irregularities. It may seem like there's no connection, but there's a lot of connection to their hair fall and their menstrual problems as well, especially for those women who are suffering from polycystic ovarian syndrome, PCOS. One of the a big fraction of women that we see here do come in because of hair fall, primarily due to PCOS. And doctor, we also see a number of female patients who come in because of thyroid dysregulation, thyroid problem, and let's not forget the ever famous iron deficiency.
Actually, when I do ask these very famous questions, when did you last do blood tests, and then they say, oh yeah, doctor, I've done it 6 months ago, 3 months ago. I said, okay, very good. Have you done an iron blood test for serum iron? Oh yeah, it was not included. So I said that is a must, because 30% of my female patient who has hair loss actually has decreased iron content in their blood. So iron content blood test investigation is a must when you come to treat a female pattern hair loss.
And over here in Hair Transplant Center, we do emphasize in eliciting the cause of hair fall, be it male or female. Like doctor said earlier, male is somewhat straightforward, but for female it's a bit more tricky business. So by eliciting the cause of hair fall, 50% of the problem is solved.
Yes, so it's a must. When a female walking into my clinic after doing a history, a blood test workout is a must. I do make them do that and come back to see me after 1 week with a full report, and from there we discuss further on the type of treatment that we have for them in the clinic.
Speaking of iron deficiencies, doctor,
Yes.
another important question we ask during our consultation
Yes.
with patients as well is if at all they have been through a crash diet or they
Oh,
lost
yeah.
weight tremendously in a very short duration.
Yes, that's right.
Because that reflects on their protein loss. That also reflects on the iron loss as well. So again, that is another thing that we can easily combat, but finding out the cause again is the most important step before we proceed on to treating the readily existing problem.
See, like we female, we are actually very disturbed. We are very stressed emotionally.
Very.
Yeah. So you know, when a woman goes through some divorce matters, they have some personal problem. If they lose their job,
Menopausal as well.
menopause, yeah, they're gonna crash diet, you know. So all these factors actually is related to hair loss. So that's why, like I said before, Dr. V, a detailed history taking in a female pattern hair loss is a must. So a consultation takes a very long time. Just history taking takes about half an hour for a female pattern hair loss. What are the causes? You know, sometimes these kind of things are very personal. So we have to very nicely talk to them and then slowly sort of dig information
You have to
out.
open up.
Yes, because even a crash diet, you know, they said, no. And then you start talking to them, oh yes, doctor, I've been on the intermediate diet, which is very popular now. Everybody is doing that to lose weight, and that unfortunately do cause hair loss.
And postpartum as well.
Yes, that's right.
That is also another, like you said, in terms of stress, it is also stress.
Yes.
In terms of hormonal dysregulation too.
Yes,
so
that's
that is
right.
also another thing that is very personal. It takes time for them to open up to us. Now, doctor, we've already discussed on the causes of hair fall and how it's very much different from a male pattern hair baldness. And besides the cause, the pattern is also somewhat different.
Yes.
And for female pattern hair loss, we use the Ludwig classification in contrast with the male, and it is pretty simple in that sense. It's divided into 3.
It's only 3.
Yes, it's mild, moderate, and severe.
Severe.
Mild, usually when we have patients who come in, they generally come in when it's a bit more alarming, with type 2 or 3.
When they, because when they lose 50% of their hair, that becomes a grade 2 or grade 2, and that's where they come running in for help.
So saliently, just to educate you all out there, type 1, it is just some patchy hair loss over the parting line. Type 2, it is moderate, so it's a bit more apparent in terms of widening of the parting line, and it's always the center, it is not the sides, unlike the
because male pattern baldness, if you look at the Norwood classification, like you're receding your hairline, you know, your forehead become bigger and all that, but in female it's actually you're parting and you can see through, the parting becomes wider and wider.
And the third one, the most severe, it looks like an inverted triangle, almost like a Christmas tree, and that is the most severe form for female. This is the common pattern that we discuss for female pattern hair loss, and there are also some that doesn't fall into this category, like a diffuse pattern, and some female do have the androgenic pattern, the male pattern, especially those with polycystic ovarian syndrome. And this again comes back to the consultation session, where we have to have one-to-one detail, so we can give you a tailored treatment plan for your problem instead of one that is generic. And doctor, now that we've discussed the pattern as well, treatment also differs, right, Dr. Inder?
Yes, you know why? Because in male, we have such thing called the safe donor area, which is a permanent area, so we can take care from there and plant it in the front. But unfortunately, female do not have a donor area that is a safe or a permanent area. Yeah, so that's the huge difference there.
But most of the female patients that we do hair transplant for, they are either looking for one or two things. Number one is to fill up the areas where it is sparse.
Yeah, to give them some density, that's right.
And another one is, this is very popular nowadays, to get a lowered hairline.
Yes, it's become a trend now.
Yes,
it's become a trend. You know, you're born with a very high forehead, and then they come in to soften their forehead. You know, a little bit of lowering the hairline, but makes hell of a difference in the aesthetic look.
Yes.
So we are doing that nowadays. It's a very trendy procedure in our clinic now.
And even those with traction alopecia because of
pulling their hair,
and and they also are good candidates for lowering hairline if they wish to. But like doctor said, you do not have permanent zone.
Yes.
Nevertheless, with proper treatment plan, experienced treatment provider, and a proper regimen for post-care, the results are very impressive.
Very impressive, I should say. I tell you, 95% of my patients are all happy patients after doing FUE hair restoration for female pattern hair loss or lowering their hairline.
So this is for hair transplant, right, doctor?
Yes.
Now when we talk about other modalities of hair regrowth like PRP, that is also a very popular treatment among female patients, women, generally those who are younger and without any comorbids, because the PRP is of a good quality, and we can somewhat gauge how the effect's going to be. But then again, that being said, PRP is yours. It is from your blood derivative, so that effect is directly reflective of the quality of your PRP.
Yes, I actually advise my patient once they start doing the PRP to take the photos at least after 3 sessions of PRP. Not like, you know, you come in and then you start comparing every 1 month. You don't really see a lot of difference there, and I don't want them to be disappointed with the PRP results. So I tell them, okay, let's do the PRP and then take your photo after 3 or 4 PRPs, and then you can see the difference on the growth of the new hair. So so they sort of listen to me, but then however they do tell me through their experience when they are at home, they tell me their hair fall is less, they can see the baby hair growing, and there seems to be a happy patients after 1 sessions of PRP.
As much as it's exciting for them, it's exciting for us as well.
That's right.
And it's very true, doctor, that you said that first thing the patients say is the hair started falling less. And very commonly I hear from my patients, they say, oh, when I'm showering, the less strands I see on the floor.
That is really scary. Actually, one of the ways of patients are showing us that they have hair loss is by bringing the hair in their bathroom. They come back, doctor, this is my hair loss. You know, I mean, they are shocked. Even I look at the amount of hair they show me. Even I, oh my God, that's a huge amount there.
And we do have hair fillers as well, especially for those who we think may not have a very good quality PRP. We do advise for hair fillers because it is a bit more objective in that sense.
That's right, Dr. V, because lately because this hair fillers has been there for quite a while, but then my patients have been on it now for quite a while, and I do see, I mean, over a period of time, because I'm looking at them like, you know, after 1 month, after 6 months of PRP, hair filler treatment, and I do see that the results are amazing. So I do advise nowadays to most of my patients to go for hair fillers, which I see is awesome results.
One thing that I realized that is a bit apparent is that most of the female patients who come into the clinic, doctor, are someone who have seen the scalp, could see through the scalp, and they want immediate results, you know. And say if they're not opting for hair transplant, even hair transplant is a journey. You know, if they're not opting for hair transplant, if they want PRP is once a month, so it takes a while for it to come. Filler, on the other hand, is 2 weeks once, and you probably would see in terms of timeline, but then again depends on how your body is accepting and recuperating along with the treatment. So doctor, we have spoke of
quite a bit
on the causes, on the pattern, on the treatment option, and also the very commonly done procedures for female patients in terms of hair transplant, like density, like filling up, and also lowering the hairline. And actually, doctor, I want to discuss on one more thing, but maybe not today due to time constraints. Another very popular treatment that a lot of female patients and all male patients opt for is eyebrow transplant, and that will be the exact topic we'll be discussing
in our next talk.
And that'll be very interesting, so please don't miss out. This is a live video discussing on female pattern hair loss. So do share and do like this video. If you want more information, please don't hesitate to get in contact with us. We are very approachable on Hair Transplant Center Malaysia.
Yes.
And do watch our videos on YouTube as well on how these treatments are done, be it PRP, filler, and even lowering hairline,
Yes,
hair
that's right.
transplant, to get a better idea on what we
Yeah.
have discussed. Thank you once again, Dr. Inder.
You're
for
most
joining
welcome, Dr. Wee.
on
Thank you so
Hair
much.
Channel, and thank you guys once again for joining us on
Yes.
this very peppy session on Hair Channel. Till next time, I am Dr. Vaishnavi Thanasaren, fondly known as Dr. V, and Dr.
Yes,
Inder.
I'm Dr. Inder, and I also thank you so much for everyone, your precious time for watching this short live video of us. Female pattern hair loss is becoming very trendy now for everyone to come in to ask for help, and I'm doing a lot of female pattern hair loss, hair restoration now. So this is the time for you to come in to ask questions and come in to see me for a consultation. Thank you so much for your time for watching this video. Bye.